Hi nursing students. This is nursing student Alex coming to you from the college. I am here with Nurse Molly. I wanted to take a moment to talk about clinicals. So Nurse Molly, how long have you been a nurse?
I have been a nurse for over 70 years.
Wow. That is a long time. Has nursing changed much in that time?
Of course it has. However, nursing has always been a profession that involves active learning. Reading about how to do something is a lot different than doing it.
That is for sure. I remember when I needed to start my first IV on a patient. It was a lot different than doing it in lab.
In my opinion, nursing is about first the evidence-based practice and information, then practicing the skills, then doing the skills, and then learning to put the whole picture together to deliver the best care to each of our patients.
I understand the learning part of the profession. It seems that there is always new information coming out.
That is so true. We learn every day. However, before we can put things into practice, we need to collect evidence on the effectiveness of the knowledge. It is a very long process and involves many dedicated nurses.
We learn about evidence-based practice all of the time. In the hospital, how do I know what the evidence-based practice is?
Well, that is covered in the hospital policy and procedures. In most hospitals there is a committee of nurses who update the policies and practice according to the newest evidence-based practice.
So the hospital policies and procedures are the nurses' tools. I need to remember that.
For nursing students, the clinical experience is about learning the hospital policy and procedures while practicing skills that contribute to patient care.
So clinicals are about the action of learning to be a nurse?
Yes, they are about learning to put everything together to provide excellent patient care. Didactic learning, lab learning, and clinical all work together.
I have also learned that I am responsible for being an active learner.
Yes, the nurses are there to help, but remember they have a job to do. You also have a job to do.
My job is to learn how to care for the patients.
Yes, and you only learn by doing.
It can be scary.
Yes, all nurses get nervous sometimes. It's natural. I want you to take a moment to really think about how nervous the patient is.
So I don't want to add to their anxiety by showing my nervousness.
Right. That is called patient-centered care. We are all here for the patients. Your instructor is here for you. Your instructor is not only a registered nurse, but he or she also has a lot of additional education. They worked very hard to obtain all of their extra education. They are here for you. Does that make sense?
Yes. I am starting to see what you are talking about.
There is also clinical paperwork that the college assigns to you. It has to be completed by the assigned day. Not only does it show that you are learning to put everything together, but it is your responsibility.
And I know that we can't pass clinical without doing it.
Your instructors take the assignments that the college requires, and spreads those assignments out over the clinical. The assignments were chosen so your instructors can help you learn to put all of the information together.
And they can't do that if I don't complete the assignments and put my knowledge into them.
Right. Learning to be a nurse is hard work, but it is all worth it. Well, it is time for my nap. This has been a great conversation.
Yes, thank you so much. I have learned a lot. I hope that we can talk more.
Oh yes. I would love that. I love to share my knowledge.